So, we're having Lesbian, Bisexual and Trans Women's Health Week, and well, I was thinking it's not every week that we do that, so I was thinking it'd be good maybe to like demystify why we're doing that, and I wondered if you guys had any thoughts, like how does it sort of touch you, or what, you know, what interests you about it?
I think particularly for me, it was very much highlighted when we had a focus group. It was for the Women's Task Force, and it was for LGBT self-identified women, and they highlighted quite a lot of the issues that were coming up that are kind of unmet needs really, and I feel that not only just being an LGBT woman, but there's also other factors that contribute to health needs that are often overlooked. So, and particularly around you know, my area in mental health, because a lot of the women who have experienced a lot of homophobic responses or misogynistic responses from health professionals find it really difficult to cope, and when their caring responsibilities are dismissed and they feel that they're trying to find coping strategies, then that usually turn to alcohol or smoking as a way of coping, and obviously then that's a contributing factor to their health needs really. Also that kind of stereotype, you know, assumption really, that I know that we've all experienced with our clients or with ourselves, this kind of like this dismissiveness and invisibility, even in terms of lesbians having sex, you know, that's kind of often overlooked, that we hold hands, and you know, it's kind of stereotypes like that.
Yeah, it's funny, isn't it? Because I went to this event for Health Week at the House of Lords, and I was delighted that somebody presented some slides about a survey of LBT women, and it was mainly around their health and well-being. But she pulled out this slide where she'd actually asked women about their experiences of group sex. And I thought, I'm used to working with gay men a lot in the HIV kind of sector and world. And, you know, that's the type of thing we would ask all the time, as if it was just like, you know, this very sort of easy thing to ask. But I was delighted. There we were in the House of Lords, and there's like a big slide up and it says women's experiences of group sex. And across the ages, like there was quite a lot of experience, which again, sort of for me, I felt this stereotype of like almost like in couples, monogamous, holding hands. It's like there's so much diversity within us and how we identify and who we have sex with as well. So yeah, it was really interesting to actually see that data presented, because I think a lot of why we're having the week as well is like to raise awareness that we need surveys like that, because if you just survey women per se, it's just like we're in this minority and you never get decent data, and we do actually have quite specific needs.
And I think you're right about the assumptions and presumptions. On a personal level, you saying that, I think it's the important thing for me is highlighting that we have and our clients have choice and control over themselves and their identity. And one recent personal experience was at an event, and he overheard a conversation that I was having with a colleague, and took it upon himself to then choose the identity he saw for me. So, and the conversation was, I said, you know, I have relationships with women, and I've always had relationships with women, but every now and then I like to have sex with a man, you know, maybe every 3 to 5 years I might just choose to have sex with a man. And he took it upon himself to come over to me and he said, well, that doesn't make you gay then, it doesn't make you a queer woman, as you said. It makes you bisexual. That means that you are bisexual. And I was really quite shocked, because I was like, excuse me? And, you know, and it was quite like, I was quite taken aback, and I tried to kind of hold everything in to not respond in a like angry way. And I was saying, well, you know, I can identify as however I want. You can't take that away from me. You know, if I want to call myself a gay woman, I'm a gay woman. If I want to call myself anything, that's who I am. And he really proceeded to just continue to argue. No, you're definitely bisexual. So if this is my experience, and it was a huge event where people should have had the kind of training and known better about how to respect people's identity. If that's my experience, then what our clients and people who are accessing services, that assumption and that kind of presumed that's who you are and this is what and there's something in that I think about. There's a power thing, and it's about something being taken away from who you are, and then your fear of you don't want to access services, and particularly if you've got layers of that, if you've got a disability, or if you're from an ethnic minority group, if you're in have this intersectionality of lots of different discriminated identities, you're going to feel that more from all kinds of angles, and you can have all those stereotypes. So if you're a black disabled lesbian, you're going to have all those different stereotypes put upon you and something taken away. That's why I think it's important anyway.
And you get people like GPs who are in a position of power in a conversation, in a clinic room. It's no wonder that young queer women don't almost come out or don't say what their preferences are, because if these people in power can't understand or can't react to those young people's identification of themselves, then they're not going to have the trust to be able to talk to somebody. And I think that's why there are quite a lot of inequalities around how people access health, because they don't feel comfortable being able to be themselves when they talk about their sexual health or their bodies or who they are having sex with. So I think it's very difficult when people don't respect people's bodies.
Absolutely.
And like people, it seems like the world has an opinion on us, or thinks that it knows who we are and how we identify, rather than just asks us.
Exactly.
And I was thinking, I was actually thinking about GPs today, because I thought actually I am quite comfortable about talking about my sexual orientation at the GP, but I'm not that comfortable about gender identity. But I thought, when I was younger, it was a lot harder. And then I presumed that was because the world had moved on and GPs are getting better on access. But actually, I think it might have more to do with my age, and the fact that when I was in my 20s and accessing the GP, I was definitely shyer, and I felt the power differential more. And nowadays, some of the GPs are obviously younger than me, so I feel like the power differential is a bit different. So there's a lot around access that's not always immediately obvious what it's all about, but whatever you reduce it to, it's like having a minority sexuality is very difficult still with GPs or the NHS.
I think you change yourself. I know that I had this conversation with colleagues the other day that within my own personal identity, how I see myself, that I am quite non-binary, in my thinking and in my ways, and when I look at myself in comparison to stereotypes in society, I feel that that's where I am at. But in terms of having a voice for women, that's when I feel it's important to then step up and say, no, I'm a woman, and to express that, the experience. And but that in itself is interesting, because you're not really always at one with yourself. If you're altering in terms of, sometimes obviously it's just easier. Sometimes you just don't want to challenge, because there's already that assumption, if the GP says, so what's your husband do, and
it's hard to go, actually I'm non-binary.
Non-binary, currently in a polyamorous relationship.
Although that is the reality, isn't it?
That is the reality.
Is that within this community there's a lot of diversity. So even though we're here having a health week, it's even within that community, it's so diverse, and really up to individuals in a way to try and I would like to see us all try and use our voices, so that maybe some people watching this will think, oh, it's the first time I ever heard people talking about it, which is great. And because we're not heard really.
I sort of see it as my duty now as an older person, And again, gender, pick one, doesn't really matter. But I do feel that now I need to fight for women. And I feel that I need to fight for younger women, because they're the ones that don't have the voice. And I think that as I've got older and I care less about what people think about me, I can quite honestly take on any challenge from anybody. And if they don't understand, I don't rush to get angry. I like to explain things to them. If they don't want to hear that, that's up to them. But I do feel now that I will fight for younger women's rights and younger women's access to any kind of healthcare, and especially lesbian and bisexual women, because I feel like they do not get the access that they deserve, and they don't get the voice that they need to be able to speak. It's hard enough to talk about your sexuality to a stranger when maybe you might have some serious concern about your health, and you're already nervous. And so actually I do feel like it's my duty now that I need to be the one that talks to those people, and especially when they're white older males, because that's what we have in a lot of positions of power. And so I don't feel I don't feel intimidated by older white males.
So it's
and
like
so
you're
then
using your privilege, aren't you?
Yes, absolutely.
To be an ally for younger women.
Yeah, I do feel that now, because I'm an older white female, that I do have a privilege. And so maybe I'm the one that needs to speak. And so I can't speak for everybody, but I'll try.
Yeah, it's exactly the same with the mental health services. I feel that need to represent, because of what I've seen before, because I've seen women getting locked up because they had a child out of wedlock, because I've seen women being dismissed in terms of their medication and how it's having an impact, and being blamed for saying that you're not taking it correctly, you're not, and then looking to the men in the family to make decisions as well on behalf of the women that are trying to access, and turning to them, and just this invisibility that lots of women feel. And so I think it's important to kind of just look at all of that goes on and represent people within services that are not receiving the full care, really.
And we know that lesbian and bisexual women who want to have children in same-sex relationships will definitely come across some kind of inequality. We know that, research tells us that. And so therefore I think in the sort of maternity or trying to become pregnant sort of services, we need to help those women as well, because actually they might come across people that are going to be understanding, but they're also going to come across some kind of homophobia, usually, or biphobia. And so I think that those kind of services need to step up. They are specific to lesbian and bisexual women who want to have children in same-sex relationships.
Because it's like people assuming, isn't it, that the partner's going to be, say if you're on a maternity ward, and the partner's going to be male. How to negotiate that. The nurses are like, who are you?
Yes.
You can't be the partner.
Are you somebody's sister?
Yeah, exactly. Are you a friend?
Were you a relative? Yes. Oh, sister? No. So there's a lot of that goes on.
That's like an invisibility as well, isn't it? Because it's like the most important moment of your life. You're having this child together, and it's like you're nothing to do with it.
But even if someone's been rushed in to have an operation and the partner's just trying to access to see their partner, and that always causes those kind of barriers as well.
So I wonder how much highlighting lesbian and bisexual and transgender women's health week does for other women. Do they see it as an opportunity to talk to their friends about stuff, or do they see it as an opportunity to maybe think about their own health, think about whether things do affect them the same as the rest of the population, and how do they go to the doctors, or how do they access healthcare around those things? Obesity, smoking, alcohol intake, social drug intake, all of those things. And also whether they're on medication whether they're being over-medicated by the medical world,
And
which we know happens a lot
Yeah.
in mental health, that people are over-medicated.
Definitely.
So I wonder whether people will
It's just that
look at their own
and I'm
health.
hoping that health professionals will as well. You know, if somebody's, just to kind of think beyond that heteronormative view. When if two women are admitted in a domestic violence situation, whether they'll even consider that might be the case. You know, that it's those kind of issues that I feel that should be looked into and taken a bit more seriously, because again there's that kind of dismissiveness, or they've had a cat fight, or there's not really anything else. There's two girls having a scrap, but actually not realising that there could be a perpetrator on the ward with someone who's a victim. Those kind of things are just generally overlooked, really. Just what is the situation, what's going on in this situation.
And there's actually very high levels of sexual violence in this population group, which that's what really struck me from the presentation of the House of Lords yesterday. Like it's way higher. It's like something like 60% of people in this survey had experienced sexual violence, and obviously some of that is from same-sex partners. So and I think that's a real taboo.
No, absolutely. And again, it's all those, the constant discriminatory factors, the drip that goes on, and the power, and the real kind of, what I feel I've experienced, that kind of misogynistic, like you end up feeling a bit like a target, and that you need to kind of either overcompensate or justify yourself, or protect yourself some way, and then in some ways all those mechanisms can end up accidentally making you more vulnerable as well, because you're trying so hard to prove who you are, and have your identity, and live freely and live with freedom and respect, that people, they don't really know how to respond to that. So particularly some not very nice people, they don't know, so and then you become a target.
We saw in the youth chances research that there was a high proportion, even though it was a low amount of young people, but there was a high proportion of young self-defining lesbian and bisexual women who were becoming pregnant because of their lack of access to contraception. Now, because you are self-defined as a lesbian woman or lesbian young woman, your contraception needs are dismissed. But unfortunately, you may have sex accidentally or perfectly intentionally with young men. If you are in different relationships, if you're in polyamorous relationships, if you are just testing the boundaries of your sexual orientation, you may well have consensual sex with young men, and actually then you're putting yourself at risk of pregnancy, which may be unwanted. And what we know is that there is a high amount of young women that this happens to, and again they're going to be in their late teens, and they are not going to have had the education that they should have had in school around contraception and sexuality.
I think that's a real a surprise for most people, isn't it? Like that's definitely research I've seen more recently, and I think it's like we don't quite know why either. Like, why are these young women more likely to be pregnant than their straight counterparts? But one of the things in my mind is just good sexual health education in schools,
which they're not getting.
And even about LGBT kind of things in schools, so that then you can say things like this. You can say, and you might identify as gay or lesbian, but you might have sex with, opposite sex partners.
Absolutely.
And that carries with it these other risks that you might not be thinking about if most of your partners are female, say. And so I think, it's definitely something that's not very conscious and not talked about enough.
And also I think it's accepted, as I said with my experience,
it's
this kind of like this blame, whereas I see a lot of
so it's hidden then.
I see a lot of men who they've come through the service where they've been happily married for a number of years in a really heterosexual marriage, but the man with the understanding and goes out and has sex with men on occasion, and the wife is fine, and that's what they've got, and this is the situation. Doesn't identify as gay, but just wants to go and have sex with men. But there seems to be that's kind of an acceptable thing in that okay, that's what they do.
Yeah.
Whereas I think if it's for women doing that, I think there's a different societal look on that and a different take on it. They said, well, we should. And again, it's that same kind of patriarchal thing. I think, well, it's your fault. You should have protected yourself. Why weren't you on the pill, or why didn't you do this, or why did you put yourself at risk? So it's that kind of blame culture, I think, that continues through, and particularly within the LGBT women community and female community, that there's this kind of assumption again, and that's quite a dangerous assumption, really, for these young women.
I think there's an assumption with that as well, of like, oh, you should be satisfied with your male partner, why would you want to have female partners, say, and vice versa. It's like we get in a terrible muddle, rather than just accept that, behaviourally, a lot of people have sex with women and men. But within both the communities or something, heterosexual and then gay, it's like very there's still a lot of biphobia.
Yeah, absolutely.
And there's a lot of we just don't talk about what our lives are actually like. So.
Well, when we talk with young people in the youth groups, quite often they will say that they are, they're best friends with their gay male or their lesbian girlfriend or whatever, and they may try out sex with each other because they're just interested. They're at that hormonal, raging hormonal level in late teens where they just want to try everything. And actually it doesn't really matter what their sexual orientation is. They're trying new experiences, and if they can do it with their best friend who happens to be of opposite sex, then they will. But the fact is that if we haven't, as a community, given them, and schools haven't given them a good education on sexual health and contraception, then we are failing them. And we should be, and we should help them, and we should be understanding, which we are, but the rest of the world out there isn't necessarily understanding, especially if then she becomes pregnant and she needs to go to the GP, and then people want to know who the father is, and he happens to be her gay boy best friend, or it all gets complicated and messy, and people don't seem to understand what was happening there. And I think that's a real shame, because that could be quite frightening for those two young
There's
people.
loads of the cultural aspects come in as well, because obviously we work with quite a lot of the Bengali, Bangladeshi, Pakistani communities as well, with the boys who identify as gay, but the expectation is that they will be married and with a wife in a heterosexual relationship. So that can cause some problems as well in terms of that identity, but vice versa. So in terms of the wives that are kind of with these men expected to bear children, also have difficulties when they want to have lesbian or same-sex relationships, that this kind of expectation that they're not going to be having sex with a man. So there's all kind of complications there in terms of that expected, unit that's happened in a cultural way, and then all the different relationships that happen outside of that as well, or can happen outside of that.